Hello and welcome to Listen.Up.People, a podcast of the USC Suzanne Dworak-Peck School of Social Work. I'm Dr. Eric Rice, professor and associate dean for research. Today, we are going to be talking about social work and health interventions. When people think about social work and health, I think many of us think about hospital-based social workers. But my colleagues today are here to share about the health interventions that they work on that go beyond hospitals and medical facilities, to shine a light on how social determinants can impact health and how interventions can be developed to better reflect the context and cultures of people in need. So I have the pleasure of introducing two of my colleagues who are leading experts in this field. First, I'd like to introduce Dr. Jane Lee, who is an associate professor here at the school, and her colleague and my colleague, Dr. Shinyi Wu, associate professor of social work and industrial systems engineering, and a senior scientist at the USC Edward R. Roybal Institute on Aging. It's wonderful to have you both here today. Welcome.
Thank you. Thanks for having us.
So I want to start off with a question that I ask most of my guests at the beginning of the episodes, which is, how did you get interested in doing this kind of work? So maybe I'll turn first to Shinyi and then to you, Jane. So Shinyi, how did you get interested in doing health intervention work?
So this went back a long history. So I'm very interested in understanding how people do things differently, which has an impact in life. And health happen to be the things I'm most interested. In the early part of my career, I got to evaluate a model called chronic illness care model, which are implemented in healthcare system to help patients better manage their chronic illnesses. And we saw quite a bit of differences in how the clinics are implementing the model and how patients are benefiting from this new type of programs to better manage their health. So that got me into thinking about what are the variations. And I see clinics with less resources, such as safety net clinics, suffered them. They didn't benefit as much. So I wanted to do something to change that. So I began to develop some models to help clinics to do it. And that wasn't enough. So I want to do some intervention to help patients directly. So that gets me into this type of work.
Very cool. Very cool. Jane, what led you to health interventions?
Yeah, so interesting, Shinyi. For me, it really started when I was in my MSW program and I was interning at a domestic violence agency, and I was working primarily with immigrant women. And I began to see firsthand that many of the tools and approaches that I was learning about really didn't fully account for what these women were actually experiencing. So factors like language barriers, lack of health insurance, barriers related to their immigration status, or difficulty finding, work or employment. And all of those factors affected not just their safety, but their overall health and well-being. And I think that experience really opened my eyes to how social determinants of health show up in people's everyday lives and how interventions have to be responsive to those realities. And so it pushed me towards community-based research and towards understanding cultural and social context, especially within immigrant communities, and to focus on developing health interventions that are really grounded in people's lived experiences and their communities.
That's amazing. You said a phrase that I know we use a lot in social work and some other related health disciplines, but you said the phrase social determinants of health. And I'd love to take a beat and give our audience a little bit of a definition. Like, what is this phrase, social determinants of health? What does this mean? Can you unpack it a little bit for us?
Of course. So I think we're talking about, the idea that people's health and well-being isn't just shaped by their individual choices or biology. It's actually shaped by the conditions and characteristics in which they live and work and connect with other people. And so, as I mentioned in my work with immigrant communities, we know factors like whether or not someone has health insurance or language barriers or, what language they speak. That has implications for being able to access health services, which can, influence whether someone can stay healthy or get the care that they need. So when we think about improving health, it's not just about, providing the medical services, or as you mentioned, like care in a hospital, but it's also about addressing those social and structural conditions.
It's so interesting that you basically just made the causal connection between what language you speak and
Mhm.
your health. I don't think most people outside of perhaps social work and public health and maybe sort of medical fields in general ever think about what language you speak could impact your health. I mean, that is such a fascinating and important concept just to deal with. And I think another phrase that gets thrown around a lot in the context of this work, which neither of you have used quite yet, but I'll throw it out there. I'll be the jargon laden one, is behavioral health, right? So this idea that we oftentimes, social determinants of health impact our well-being, but it's through this concept of behavioral health. And so I know, Shinyi, I know you have done a lot of work around behavioral health. I mean, do you maybe want to give our audience a little bit of an understanding of like, what is behavioral health? Like, what does that even mean?
Yeah, so I think that comes from my background of a systems engineer. So I'm very interested in what are the processes and the steps that get to the outcomes. So the structural components that Jen mentions is very important, but health is a process. So how we eat, how we do physical activities, our sleep, how we manage stress, our choice of taking medications or adherence to the medications or choose other substance to manage stress. These are all behaviors that could have impact on outcomes. So my research and my intervention are targeting on these behavioral processes that we can either improve or make this decision differently that can improve patients' outcomes.
Thank you for sharing that. It's so important, I think, for people to understand this idea of social determinants and what it is that we're talking about with this behavioral health, because so much of our health is impacted, as you said, Jane, by things out, that one might not think about, like language or the neighborhood that we live in. And the causal linkages are oftentimes through the things that we make decisions about that impact our health. So thank you for clarifying that for us as well, Shini. I want to get into the weeds a little bit for with both of you on the work that you're actually doing in this space. So I know, Jane, you alluded to at the beginning that you're really interested in immigrant health and the sort of the context. I mean, what are some of the health related interventions that you are working on now that you're most excited about?
Yeah, so there's a lot there, but a lot of my work is focused on HIV prevention and care as one of the, primary outcomes. And what I've always been drawn to is interdisciplinary research and collaboration, which, Shini is a great example of that, given her background in engineering. But the reasons I love social work and looking at health outcomes like HIV prevention through a social work lens is it really brings together insights from so many different fields. And with my work in HIV prevention, one of the kind of frameworks I use come from health communication. And I'm doing some work on this idea of key storytellers, which comes from
Mm.
communication infrastructure theory, which is really just looking at how information flows within communities. You mentioned a lot of the different factors that go into different health outcomes. And in any community at the individual level, there are certain people, whether they're kind of have formal roles or informal roles. And these people are individuals that folks might turn to for guidance or support for trusted information. And so these are kind of the key storytellers that in my research with Latino men who have sex with men for HIV prevention, I really wanted to understand who those key storytellers are and how they share information about HIV prevention, especially considering differences in language, geography, access to resources, including, health and HIV prevention resources. So the goal is to really build interventions that amplify those voices, those trusted voices that are already doing a lot of this important work within their own communities. So whether it's HIV prevention or kind of mental health or oral health, I really kind of think about it with attention to social determinants and thinking critically about the resources and strengths that are already within the community.
I love that. I love that. I often spend time thinking about the context is almost always the most important part of the problem. And your both of your work hones in on the importance of that. I think, Shinny, you and I have known for one another for quite some time, and I know about a lot of your health related work, but there's a project that you've been working on recently that I really want to nudge you to talk about, which is around, if I remember the context exactly correctly, it's about Chinese Americans and whether or not they're going to uptake a particular kind of surgery. Can you maybe tell us a little bit more about this and again, how context and language and all of this matters in the work that you're doing?
Before that, may I respond to Jen's work?
Oh,
Because
of course, go for it.
you and I actually went back a long time when we both work on HIV related work. And part of my work was actually evaluating cost effectiveness of different interventions treating HIV. But the type of intervention you're doing, Jen, is new. So maybe at some point I could update my analysis to include your type of your type of intervention. But
I think all three of us have worked on HIV related interventions in the course of our careers. I think we could probably just have done a whole episode on HIV related interventions, not health interventions. But I know, Shinyi, your most recent one is not in the space of HIV, and so maybe you can tell us a little bit about that one too.
Yes. So the work I did with HIV and the work I'm actually doing right now have some common theme, which is how do we deliver care more effectively and efficiently, as well as more affordable. So when I evaluating HIV interventions, I look at the cost effectiveness. In the specific project I'm currently doing right now is that we know there's intervention that's effective and that benefit patients of different cultural backgrounds or different languages. But certain groups of patients, like Chinese Americans, are less likely to accept that type of interventions. So that type of decision making make me wondered why and how we could help them. So I think really social work helped me to have this concept of getting into listen to people's story. So I first begin this project with interviews with patients to understand their experiences. And part of that, I get to understand why they make decision this way. Could be they are lacking the information from providers because patients don't speak English as fluently, and the information they were given were in English. So that's the language part that could affect health. The other issue is patients' assessment of their conditions are different, grounded in their cultural background. Like in Chinese culture, people feel that they should sustain discomfort. Part of the reason, believe it or not, so they don't want to bother other people, including their providers. So those stories and those information needs are the reason that I begin to develop these interventions, which is intended to support patients to make more patient-centered decision making.
The context is, as I said before, it's just so important. And I know, Jean, your work with HIV, you take context very, 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 very seriously. Can you maybe tell us a little bit more about some of your work, relates to this sort of idea around that Shinyi was sharing with us as well?
Yeah, I mean, I resonate a lot with what Shini was saying because we're talking a lot about, implementation issues. Just because an intervention is quote unquote effective doesn't mean it's necessarily going to work for all communities, right? We have to look at what's feasible, what's acceptable in different populations and groups. So really asking these questions about, implementation science and what can be really sustainable outside of the research study or a specific kind of clinical trial that we might be doing. So really thinking about the sustainability of such efforts. And I think one important way to really ensure that is to involve communities in research and in our studies, and even in the questions that we ask, because they understand the context, they understand their priorities. We might have a particular interest of an area, even my work, as I mentioned, when I was doing kind of DV work, I realized we're talking about issues related to domestic violence, but some of the my clients' priorities were kind of beyond that. It was, how they need a safe place to stay. They need to find a job. And so all of these other factors come in. So I think it is really important to center communities in our work and make sure that they are bringing in their perspective so that at the end of the day, the interventions really work for them and address their priorities.
I think that in social work, we almost take for granted that people should talk to people in communities, but I don't think that it's necessarily something that a lot of other fields do. But I know, having seen presentations by both of you over the last year that both of you take very seriously the communities that you work with and you partner with them. It's not just that you're studying them, but you're actually partnering with them. You're actually involving them legitimately and earnestly in the process of helping you understand what's happening and to create solutions. And I think it's a really beautiful thing that I've seen in both of your work. And Shinyi, you alluded to this project where you were interviewing a lot of people around some of the cultural barriers to believe it. What's the condition that you're addressing in this particular intervention? It was like a type of surgery, right?
Yeah, it's condition related to conjunctive nose. It's called chronic rhinosinusitis.
Okay. It's a surgical procedure, and that some people and you found this, as you were saying before, that there are folks who are not wanting to take up this surgery, which has been shown to be effective. After you found out from the community what some of the barriers were, what were some of the ideas that you then brought as possible solutions?
So the surgery is called endoscopic surgery, which is the non-invasive surgery. But surgery, the term sounds to some patients is not an option they will take. This is the last resort. Despite our study shows patients have significantly improved their quality of life. This is a disease. It's not life or death disease. This is a quality of life disease. But the improvement in quality of life is dramatic. It's even greater than treating your heart disease or diabetes. But patients are still concerned about it. So utilizing the community concept through the interviews, we try to bring people in the community to share their experiences and convert that into a story in our intervention. So Adrian and I also use storytelling in our intervention. So we provide a website, one of the interventions component I often use to make information more accessible, available, and more standardized as part of the communication. And so we provide information about the conditions in the language that patients are familiar with, so we can address the language barriers. We use visuals to help improve, the understanding. So those are standard communication tools we use. We ask patients what they frequently ask questions, so we can make the information more succinct to answer patients, especially patients with cultural or different language background. They have different type of questions. So we try to make this process very clear to understand the information. But more innovative is that patient story part. So we ask patients if we can convert their interviews into story to share with others. And we found very interestingly, patients, when they first see the website, they go to the patient stories and looking for people most similar to them. Race, language, gender.
I love that, Shinny, because a lot of my work right now is also kind of involving peers, right? Because it's this idea that it's not just about the information that you get, but who's delivering it, who's kind of sharing their experiences, and can you relate with them? And do you kind of see yourself in them? And oftentimes, when that's the case, you're more likely to, trust that information or utilize that information. So I think that's so important because it isn't the case that, if the interventions exist, people will use them or, there will be uptake of them. You need to understand how to best engage folks and make sure that it's acceptable and think about norms as well. So many parallels, which I love.
Yeah.
Yeah, I see those parallels as well too, and I'm glad that you highlighted some of them. Another parallel that I was going to try to prompt you about, though, is also the use of technology, right? I know that you've also thought, Jane, a lot about how you can take advantage of particularly social media. You want to talk a little bit about that too?
Yeah. So, the idea of using social media too really came from the community itself when, social media platforms were becoming more popular. It was actually community partners who were like, how can we use this as a tool for HIV prevention, especially for Latino immigrant communities. And so they were interested in it because it was something that was developing. And a big question for me was also, there might be a digital divide, right? So did the people we want to reach even have access to social media or reliable technology? So similar to Shini, our early work was really focused on understanding people's experiences with these platforms, asking whether they wanted to even receive HIV prevention information that way. And so we also wanted to think about how we can make any content that's delivered on social media platforms meaningful and culturally relevant. So it wasn't just, information being pushed out, but communication that actually resonated. And I think what's exciting is that, social media and technology are constantly evolving and new tools are being developed. So that means we have to keep listening to the community and adapting how we use these tools, because the ways that we're connecting and sharing information and engaging with each other are rapidly changing.
Indeed, indeed. I mean, I could riff with you, the two of you, about that aspect of this work for hours. I mean, having done HIV prevention related work around social networks and social media and all this stuff, I mean, I love it. I think it's also kind of cool that this episode is going to be airing during National HIV/AIDS Awareness Month in December, and so I think it's nice that we've had Jane, your work explicitly, but also Shinyi, for you to remind me about your origins in HIV prevention and care work, and also then reminding me, oh yeah, right, Eric, you do a lot of HIV oriented work as well too, and you also like to center the voices of the communities and all this. It's really fun to share this time with you, thinking about these important issues. We're kind of running toward the end of the time that we have together, but I always want to make sure that I leave my guests time to leave something of a parting thought for our listeners, because I think my intention here is to introduce people to topics, knowing that there's so much more to be said about both of your lines of research, about health interventions. We could have a whole series just on health interventions. But since you're here with us today, I'd like to give you an opportunity to leave our audience with some parting thoughts, perhaps something that you think they might misunderstand about health interventions, or something that you think that from your own work, working with the communities that you work with, you really want to elevate for our audience to think about. So maybe I'll turn to Shinyi first and then to Jane. Shinyi, what would you like to leave our listeners with?
Studying health interventions for a long time, I began to think about the intervention fit with individuals. We have talked about people with different languages, different social determinants of health. So the intervention is not one size fits all. I think researchers will use intervention based on evidence, based on the data we know the best, based on the community needs. And I'm hoping with the technology, we will be able to deliver more patient-centered fit of the type of intervention with individuals' needs and their living experiences and the social determinants surrounding them. So the type of work I begin to do is to also look into more patient-centered, as well as understanding different type of patients, like different type of decision-making, different type of health behaviors. So we can do more intervention that's based on person's strengths.
That's wonderful. Jane, what would you like to leave our listeners with?
Yeah, I'm reflecting on some of what Shini said. I agree, one size doesn't fit all. And to a point you mentioned earlier about, is research taking place on communities or really with communities? And that's a question I really, ask my students to think about in classes that I teach, like how was the research done and were community perspectives integrated? And I think that's really key, because health doesn't happen in isolation. So we really need to understand the broader environments that people live in, their relationships, and all of the different structural factors that shape their experiences. So I think it is really understanding community perspectives. And I hope it's not just social work, but that, all research kind of works more towards that approach, like really engaging community perspectives, recognizing also the diversity within communities, taking an intersectional approach as well, recognizing the multiple identities that people have. And also, really asking, when we design health interventions, like what are community or cultural strengths that we can build on? And I think that can really help ensure that interventions are not just evidence-based, but also, culturally informed and really responsive to the realities of the communities that they're meant to serve.
Well, thank you so much for that. It's beautifully put by both of you. And I think with that mission in mind, I have every confidence that both of you are going to continue to develop yet more interventions that really hit people in the places where they are. And it's great to have colleagues like you that are so committed to really listening to community and really developing programs with those communities that serve those communities, and the nuance and the heterogeneity and the individuality and the strength that those people bring, which I'm left with a lot of warm, fuzzy feelings today after having this conversation with you, which is nice because health interventions are oftentimes when we're seeing people at not such great points. HIV is a very serious disease. Sinus conditions that you're talking about, Shinyi, I mean, these are serious things, and it's great to have a moment of hope and inspiration that that we're going to be working with communities to build interventions that work for those communities. Well, if you, the audience, want to learn more about the research here at the USC Suzanne Dworak-Peck School of Social Work, you can visit our school's website at dworakpeck.usc.edu. And if you have any questions for the guests on our show, or you want to support our transformative research and programs here at the school, you can contact us at Listen.Up.People@usc.edu. And Jane, Shinyi, thank you both once again. It was wonderful to have you.
Thank you, Eric. Pleasure.